In 1953, with great fanfare, Moses Cone Hospital opened its doors to treat the citizens of Greensboro, North Carolina. It would be another 10 years, however, before those doors would also open to African American physicians and patients, giving them full access to the hospital's state-of-the-art facilities. It was in Moses Cone Hospital's hometown of Greensboro that the legal battle to force hospitals to give African American physicians full and equal access began, and ultimately succeeded. One of the 11 individuals directly involved in that battle was Dr. Alvin Blount.
As far as we're concerned, you're a hero. You really, truly are. And we just wanted the opportunity to acknowledge you and spend a little time with you, and maybe hear a little bit more from your perspective about what it was like.
I was just coming from an institution, the Army, which had almost everything you want to work with. And I learned there that men can work together regardless of race, color, creed.
When he returned home to North Carolina in 1954, he was quickly reminded segregation was still the norm. Dr. Blount had seen his fair share of battles in Korea. Now he realized there was another one coming right here at home.
There was no demonstrations, there was no strikes, there was no fights. We were trying to do it all through smooth, common negotiation. You must remember we live in a different age. The only way we had to write letters to each other. And you get my letter and I wait for you to answer, then I read it, but then I answer it.
This campaign of letter writing and trying to use discourse to further their cause continued for years. During that time, the increasing national focus on civil rights kept getting closer and closer to home. In 1958, the Reverend Martin Luther King Jr. came to Greensboro and spoke. On February 1st, 1960, 4 young black college students from North Carolina A&T State University, Dr. Blount's alma mater, staged a sit-in at the Woolworths in downtown Greensboro. The Woolworths sit-in became one of the most enduring moments of the civil rights era. Dr. Blount and those aligned with his battle for equal treatment at the hospital realized it was time to try a different strategy. Led by dentist Dr. George Simkins, they filed a lawsuit against Moses Cone and Wesley Long hospitals in 1962.
We said that if we lost, we would really be sitting over there talked about. And if we won, we'd be heroes of America. So some of us were brave enough to sign on.
In Simkins versus Moses H. Cone Memorial Hospital, the 11 plaintiffs argued that the use of public funds to expand and maintain segregated hospitals was illegal. In essence, the doctors were challenging that either the hospital should immediately admit black physicians and patients or forfeit any and all allotted federal Hill-Burton funds. The Hill-Burton Act of 1946 essentially created a pool of funds to help build, run, and expand hospitals throughout the United States. In what must have surely seemed like a coup for the plaintiffs, Robert F. Kennedy, then the U.S. Attorney General, even filed a friend of the court brief on behalf of the plaintiffs.
We figured the courts was a nice, quiet way of going about it without having everybody marching over the corner when the flag opened up.
Unfortunately for Dr. Blount and his co-plaintiffs, the court initially sided with Cone. The 11 plaintiffs and their lawyers were not about to give up, however, and quickly appealed to the U.S. Court of Appeals. Less than a year later, in November 1963, the court found that the hospital had violated the 5th and 14th Amendments because they had accepted Hill-Burton funds. After the Supreme Court denied to hear the defendant's appeal, the battle was over. Like the Greensboro Four, the plaintiffs in Simkins versus Cone had changed not only their own lives, but the lives of every African American in the United States. But to Dr. Blount, only one thing really mattered. He would get to treat patients at Moses Cone.
And thank you for opening up the doors for me and a lot of our colleagues and showing us how we can all work together.
If you would allow me, and I really consider it an honor and an overdue honor, I'd like to say on behalf of Cone Health to you, on behalf of your colleagues, on behalf of the citizens who were denied access for that period of time, I would like to apologize on behalf of Cone Health for the segregation and for the discrimination that you experienced.
With the deepest appreciation for your efforts to apologize for this, I accept it with the fact that for always we'll be together.